Onto these disturbing details now. So get this, 1,300 young women in South Africa are infected with HIV every week. This is according to the National AIDS Convention of South Africa. The organization says this continues despite several sexual health and HIV awareness educational campaigns launched by the Department of Basic Education. For more on this, we're joined by Vincent Domingo, who is the General Secretary of the Gugulethu Development Forum. Thank you so very much for your time. I'm wondering perhaps if you were able to engage with NACOSA and actually give us more details in terms of how we got to the figure of 1,300 infections a week.
Yes, good afternoon. Thanks very much to you and all your listeners. Yes, the unfortunate part that we were hit hard by the COVID-19 pandemic. And obviously, during the hard COVID, schools had to lock down. And the question that we are asking ourselves as Gugulethu Development Forum is that in rural areas and particularly in townships where people live densely populated, is that what has the young people been doing in terms of those days they did not go to school? Obviously, others, because of recreational resources, others found themselves being busy with drugs leading to sexual activities. And that sexual activities mainly could have been them not be using protection. That's a serious problem. Now, it led to many of our young persons having HIV/AIDS. Statistics that I have also researched, that is the State South Africa Media Population 2021 statistics, says that there's about 13.7 of our population, was people living with AIDS. The research was from 2002 to 2001. So there have been a slight increase in people living with AIDS, particularly young persons.
Mm. We know that the most vulnerable are young women and girls, right? So what is behind that, and where are these men that are infecting these young women?
You know that the COVID-19 pandemic has disrupted other diseases like HIV. So you had a process where the prevention campaign for HIV/AIDS took a dip, meaning that there's not been promotion of abstaining and people also condomizing. Now, because of those young ladies, same parents during the pandemic were retrenched, most of them. So in our communities, where did they look after? Where did they go to? They went to older people that they call blessers or whoever to give them the necessary resources because for them to survive. That is that young people. It was at home. Parents were retrenched because of the pandemic. There were no food on the table. People have to wait long for the 350. So those young persons were vulnerable, and all the young males took advantage of that during that period. Also their own peers, because they were living with their own peers and during the pandemic. Nothing to do, no recreation, as I said. So they were also engaging unprotected and possibly sex during that period.
In the absence of government intervention that you talk about, right, that COVID-19 has disturbed a lot of programs, what is it at a community level that we can do? How do you go up against hunger, right, where a young person would rather, give themselves up so that they are able to put food on the table? What do we need to do at community level?
The unfortunate part is that we are living what we call in a poverty trap. Our rural areas and in townships is trapped in poverty. Now, the only thing we can do as community leaders at this present moment is to engage government and engage the private sector to bring programs, particularly economic programs, but particular programs that will see that young people get a job at the end of the day, for them to have that access to that programs. So the one of our responsibilities at the Gugulethu Development Forum is to lobby government and private sector, those big multinational companies, to invest in places like Gugulethu. But you must understand that Gugulethu is already what we call, as I mentioned, in a poverty trap. What we are engaging government now is because government is talking about the new mega cities. So our question here in the Western Cape and Cape Town to say that, where is the mega city going to be here in Cape Town? There's rumors that it's going to be in Quebec. So we are saying that young people of Gugulethu and people of Gugulethu must then go to that mega cities to have new cities where they will be excluded outside the poverty traps of Gugulethu. Because Gugulethu is densely populated, Gugulethu is overly populated, and the people that lives in Gugulethu and the surrounding areas, most of them are unemployed and do not necessarily have access to necessary resources.
The National Department of Health has got a PrEP program, and they've also got comprehensive sexuality education programs. Are those accessible to the young people of Gugulethu?
The new talk of the town now, or the new animal in the room is the pandemic COVID-19. People must go and test and things like that. So those programs are not really visible in our townships. The only programs now only speaks on COVID-19. So that is where we are. I have also been beginning to engage government to say that the programs that existed before COVID-19, HIV programs, awareness in our schools from government, the education department, the health department, and other departments used to come together and have that active program. So we do not have those programs in our schools anymore, particularly extramural activities where those people will come and sell the ideas in terms of condomize or to abstain, you understand? So we are still engaging government to regroup and begin we now level 1 lockdown to re-implement them in our townships.
It's a desperate situation, but would you say it's hopeless?
It's a desperate situation. Definitely it's not hopeless. Definitely it's not hopeless, because we should begin to find a way in terms of how do we live with the pandemic and also live together in terms of solving other diseases like HIV AIDS, you understand? The room is dark at the moment, but I think there is still a light at the end of the tunnel. The stakeholders like government, private sector, and community leaders to come together and have new initiatives, be innovative, how we are beginning to attract our young people. In our township, many of our young people have cell phones. They have smartphones. Why don't we create apps that talks to educational programs like HIV that they can freely begin to access? We need in townships what we call access to internet. We do not have access to internet. That is new innovations where people can get free internet. Once they get free internet, we can say that whoever service provider, whether it's Vodacom or MTN, give that free access, that 50% of those programs should be educational. Some of them must talk around HIV and AIDS. So we must come together and think smart, think innovative for us to live with this pandemic.
It's something that has an impact on all of us. Thank you very much for your time. Vincent Domingo is the General Secretary of the Gugulethu Development Forum, talking us through those very shocking revelations. 1,300 young people getting infected with HIV every week in South Africa.